Hi, I am Mabel Balanday, and today I will discuss about the sexual health and sexually transmitted diseases or infections. The information about reproduction is necessary so youth will understand how male and female reproductive systems functions and how conception and or STD infection occur. Adolescents often have inadequate information about their own and or their partner's body. Teens need this information so they can make informed decisions about sexual expressions and protect their health. So first, we have to discuss about what is sexual intercourse. Sexual intercourse is one of the most common behavior among humans. Sexual intercourse is a behavior that may produce sexual pleasure that often culminates in orgasm in females and in males. Sexual intercourse may also result to teenage pregnancy and or STD. In programs for youth, discussion of sexual intercourse is often limited to the bare mentioned male-female or penile or vaginal intercourse. However, youth needs accurate health information about sexual intercourse, vaginal, oral, and anal. There are misconceptions of having sex. First is, all teens are having sex. Having sex makes you matured and an adult. Something is wrong with an older teen, age 17 to 19, who is not having sex. A girl can't get pregnant if it's her first time. You are a virgin as long as you don't have sexual intercourse. Oral sex doesn't count. Oral sex is no sex. Premarital sex is sexual activity practiced by people who are unmarried. It can be any sexual relations a person has prior to marriage. The alternative terms for premarital sex have been suggested, including non-marital sex, which overlaps with adultery, youthful adolescent sex, and young adult sex. There are factors that encourage having premarital sex. First is having poorly educated parents, unsupported family relationships, lack of parental supervision, friends who are sexually active, poor school grades, poor academic performance, poor spiritual exercises, not hearing mass, or lack of church involvement. Engage in risky leisure activities. Next is the sexually transmitted disease or infections. These are also known as venereal disease or VD. They are passed through sexual contact or genital through vaginal intercourse, oral sex, and anal sex. The term STI evolved from venereal disease to sexually transmitted disease, then sexually transmitted infection, which has a broader range of meaning. You don't have to be it to infect others. An example of STI is HIV or AIDS. HIV is human immune deficiency virus. This is retrovirus genetic info at RNA than DNA. HIV is the virus that causes AIDS, and it is preventable and manageable but not curable. AIDS is acquired immune deficiency syndrome. Since this is a syndrome, there are several manifestations of breakdowns in body's immune system and have developed in people who have been infected by HIV. How do people get AIDS? AIDS developed through bodily fluid that includes blood products transfusions, semen and vaginal fluid, intravenous IV, drug abuse, or when you're sharing needles and use of unsterilized blades. Sexual intercourse, unprotected vaginal, oral, and or anal sex.